Prior to the Maryland Rural Health Association, I actually worked at Garrett Regional Medical Center out in Garrett County in that hospital. So very familiar with working in rural hospitals and the way that hospitals work with the community, and it's a partnership. And so those are my most recent experiences that have brought me here to this position.
And that's a demographic that we are excelling in right now,
Yes.
I think.
Yes, absolutely. There is an aging population here in Kent County and in Chestertown, and so it makes a lot of sense to focus these programs specifically on that population. And we can talk a little bit about those, but the aging friendly health system, that's one of the designations that we're going after, and going into mobile wellness, bringing care into the community for patients that aren't able to get to the hospital, for patients that don't drive, and so and bringing on a health educator. So those are some of the highlights that I'm really focusing on here in my position to help that population specifically. One, we are officially Maryland Rural Hospital. It's the only hospital that has this designation in the state. So it's really exciting that we get to experience this and be the pilot really for not only for the community, for the Eastern Shore, for the whole state, and even for the other communities in our country to look at. But we have started the age-friendly health system journey. We are applying for level 1 designation, and we're hoping that we'll be receiving that soon. Our goal is by July of 2022 to have achieved level 2 designation, but that's a process, and we're learning all the time about what's involved with that. And it's really about focusing on the 4 M's. The 4 M's are what matters most: medication, mentation, and mobility. Those are the 4 M's that we are focusing on, and really those are to really make sure that that senior population has the care that they need, and that we're focusing on those 4 M's. And everything goes around what matters most. Finding out what matters most to that patient will help make sure that the other 3 M's are in alignment: mobility, mentation, and mobility. So that's really what this journey is all about.
Okay, so how is that information assessed?
So it's assessed through a number of different parts of the process, through nurses and physicians and community caseworkers when they arrive, through their care. There's a lot of different pieces. Again, getting all the different players in rehab and pharmacy and what the rehab services, really bringing all of these services together to make sure that there's that holistic care, again, focusing on what matters most to that particular patient, because it's going to differ. For some patients, what matters most might be that they get to go home after their hospital stay, and instead of assuming that they're obviously going to go to some sort of long-term care facility, it's really asking the patient, what matters most to you, so that the whole care team can be on the same page for their care. So the levels, so we're working on this designation through the Institute for Healthcare Innovation, IHI. They are the organization that administers this designation. And so there's different levels. Level 1 is that you have started on the journey, that you are starting to collect data, you're making sure and implementing these processes. And then level 2 shows that you have implemented these processes, and you can show X number of months of data to show that you are getting the information and working on the 4 M's for each patient 65 and older. So that's really where we are working towards. But this was the model that was deemed the most appropriate for this population. And what's really cool is that I'm part of a network of other health systems across the country that are going on this journey. And so we have peers and we have meetings and we talk about what worked there, what didn't work. And so we just have this network. And there's a couple hospitals in our state that have done this designation. So we have some colleagues right in our backyard to talk to. And then there's also one of the other system hospitals also going on this journey. And so we have peers there. And so no one wants to reinvent the wheel. We want to learn from each other and lessons learned and best practices. So staying connected, asking questions, and really working with the other systems to figure out what makes the most sense moving forward in this process. So the other really exciting part of this journey for us is to develop the mobile wellness team. And this is really similar to some of the other communities where they have the mobile integrated health out of their health department. So it's a little bit different here being hospital-based, but it's a team of Shore Regional staff that are going to be going out into the community, into the Chestertown community, but across Kent County, going into people's homes, doing community events in the firehouses and churches and other community places to provide health services to patients, to eventually even do remote patient monitoring and really help patients get the care they need in their home, in their communities, without having to travel here. We've learned through COVID even, especially, that it's so challenging to get to the hospital. And so we really want to help patients where they are, where they're comfortable. And we're really excited for this new team, and we think it's going to be a great benefit for Kent County. And I'll tie that right into, we're also hiring separately from that, but very much related, a health educator. And this health educator, she'll be working right out of this office, hand in hand with Dennis and I. And she's really going to be developing a calendar of events for the whole year of health opportunities, health programs and classes and community events. And she's going to make sure that she's working closely with the health department, with Shore Regional across the Eastern Shore, and with UMS, and making sure that all of the different services and health events and education events are all in line. And that's really going to be great. So she'll work with the mobile wellness team. So we're really excited to have that key person here at the hospital and for Kent County, so everyone knows, okay, this month, these are all the events that we have. And for example, there could be something in Easton. Maybe we can put together a bus and we can, pull everybody together and do that education class. So there's going to be a lot of exciting things that we can really coordinate.
That's great. I was just out at the new YMCA, and they're devising some programs out there that are interesting.
So that's exactly right. So the health educator, she's going to make sure that we don't want to have 2 diabetes classes every Tuesday. Okay, if the YMCA is doing a diabetes class on Tuesday, maybe we should do one Thursday afternoon, and maybe we should work it out so that we can share resources and that we're coordinated and not duplicative. So our hope is that all of these programs, the age-friendly health system designation, the mobile wellness team, the health educator, and a lot of the other services that we're doing, it's all going to be part of this Aging and Wellness Center of Excellence. We're going to bring together all of these services into the hospital, into one area, so that patients can come and receive all of those services in one area and be coordinated and be linked into other outpatient services that they might need. So that's really our long-term vision. We've started recently talking about what that's going to look like. How are we going to make that happen? And so all of these services will hopefully be co-located in one place. And so that's really the ultimate goal, to have all of these services together and, again, be that center for excellence.